Hi everyone. Hello. Welcome to another episode of 30 Minutes with me, Dr. Sylvia. How are you all doing? Hope you're doing well. You're all doing well. Okay, what a week it's been. So glad that we've come to the end of the week. I hope you're all doing well. We've got another interesting topic to look at today. I was actually of two minds whether or not to deal with a question, but this issue around how we talk to people with PCOS or PCOD came up, and I thought, you know what, let's explore this topic. So if you're just coming across the channel for the first time, welcome. My name is Dr. Sylvia. I'm a general practitioner and health educator with Askawayhealth. And here we discuss health information to help you feel and be better in every way. And if you're watching this on the replay, I hope that you find value in this particular topic. I think that we underserve a lot of women with PCOS. PCOS or PCOD, by the way, means polycystic ovarian syndrome or polycystic ovarian disorder or disease. And I'm going to talk a little bit about the condition, just a little bit, because I have a lot of videos on the channel where we already talk about PCOS in detail. So that's not really the purpose of tonight's program. We're really going to talk about the things that people who are uninformed about PCOS say, and it's important to address those because these could be relatives, they could be partners, they could be friends, they could be employers who have the wrong idea of what PCOS is, and so it's important to try and correct the misperceptions. That's what we're going to try and do tonight. So if you're just joining, welcome to the stream. Thank you for coming in. Please don't forget to like it and of course subscribe to the channel. Where's my banner? Because I always forget. Let me put it. Yes, let's put it on the ticker. Not that one. Come on. That one. Let's put on the ticker for a few minutes. So don't forget to like the video and subscribe to the channel. But yes, that's what we're going to be talking about today. I hope you're all doing well. It's been a busy week, and wow, how has January flown? We are literally on the second to the last week of this first month of the year. 2023 has just been kicking ahead. So I hope you're all doing well. Right, so we're talking about PCOS. What is interesting to us is the different misperceptions that people have about this condition. We're going to be addressing them. But first, let's talk about what is PCOS. Let's give a little bit of a summary. And like I said, if it's the subject that you really want to learn much more about, I have a few videos. If you go to the women's health section or the reproductive and sexual health section playlist, then you just have a search, and I will add the links in the description box of this video once we're done, so that you can quickly find it. But polycystic ovarian syndrome or polycystic ovary syndrome or polycystic ovary disease or disorder, it's a condition that happens in women, of course, where there is an imbalance of hormones. Okay, so this hormone imbalance leads to a lot of different issues, and of course, as you will guess from the name, a lot of the issues associated, a lot of them are related to the ovary. Okay, so there's something going wrong with the ovary. In many women with PCOS, the ovary is bigger than it should be. It's making cysts, and because of those cysts, the ovaries are not effectively doing their job properly. And one of the jobs of the whole ovary is to ovulate, and the other job related to that is to make hormones. It's not doing this job effectively, which leads to excess amounts of testosterone in the woman, abnormal amounts of estrogen and other hormones, insulin, for example. These in combination leads to the problems that we find in people, women with PCOS, and result in some of the symptoms. So there's hormone imbalance, there's an ovary that's not working properly. Because of that, the woman is not ovulating regularly, and of course that leads to infertility, which is one of the big issues with PCOS. Okay, so now that I've talked about that, as always, I have a couple of slides I want to share with you guys. If you're joining the stream live, hi, I hope you're well. Please leave a comment. Let me know where you're watching from. If you want to contribute to the stream, by all means do leave a comment and I'll read it out in a bit, but let's just go into the topic. So I do have a couple of images I want us to have a look at. Let me just put them up for you. And I hope you'll be able to see this. don't know how well you can see this, but I hope you'll be able to see this. So on the screen, I have a little graphic here that shows PCOS. It's just looking at the symptoms. So this is a chart of some of the symptoms, not all of them. There are more. And again, as in many conditions, a woman may not have all of the symptoms. And the other thing to remember, and I think it's very important about polycystic ovary syndrome, is that it occurs on a spectrum. That means that you can have somebody with the same PCOS but have mild symptoms. You can have somebody at the very end of the spectrum, and then you can have somebody in the middle or anywhere in between. So, and that might be confusing for some people, because if it's the severe form, then you can say, yes, there's something obviously wrong. But if it's sort of mild and they don't have certain symptoms that the person with severe disease have, it may be easier to say, oh, there's really nothing wrong with the person. So the first understanding after you know what PCOS is that the condition happens on a spectrum. So that if you have 50 women in a room who all have PCOS, they might have different degree of symptoms. They might have different symptoms, okay? So some women will have issues getting pregnant, while some women don't have issues getting pregnant. Some women may suffer with hair loss and spots and all that, but other women don't. So it's really important to have that at the back of our mind. So just a quick read through at this chart that I've got here. So some of the symptoms that you might find with PCOS, they can have hair loss. Some others can have excess hair. They can have pain in the pelvic area. As I've mentioned already, they can experience infertility. Some women can have difficulty with weight, excessive weight, so they're overweight. Women may have irregular periods. They might experience tiredness, fatigue. I've also mentioned just now about high testosterone levels and acne. These are just a few symptoms that women with PCOS can have, okay? And I wanted us to just make sure, just a quick review of the symptoms before we tackle the different things that you should not be saying to somebody with PCOS. Okay, so as I've mentioned, PCOS, the ovaries aren't working properly. A woman is not ovulating, may not be ovulating regularly. It's related to abnormal hormone balance, and it's not just estrogen. Testosterone is involved. You also have insulin involved, and you might have heard about the relationship between PCOS and diabetes. Well, this is where it comes from. Because the body is not processing the hormone insulin properly, it is possible that there might be an increased risk of developing diabetes. And the presence of insulin, the excess amount of insulin in a woman with PCOS, is also responsible for something else, which is the fertility. Okay, so the fertility issues in women with PCOS is not just because, the ovary isn't working properly, they're not ovulating properly. It's because they might have too much testosterone swimming around in their body. It's because the ovary itself is not, the structure of the ovary is abnormal, so it's not doing its job properly. They've got a lot of cysts, and because those cysts are empty, I'll show you a picture of what those cysts look like in somebody with PCOS in a second. They're not working properly, so she's not ovulating. She's having irregular periods. She's got too much insulin. Her weight is excessive. All these things can contribute to the problem with fertility in somebody with PCOS. Right, so let us go to, in fact, before we do that, let me just share that picture because I might forget to show it to you. So let me just, so this is a nice comparison picture. I hope you can see it clearly. Let me take away the ticker. So don't forget to like and subscribe to the channel, please. If you're watching on the replay, if you're watching now, please give it a like. Subscribe to the channel. Let me know if you've got any comments, any addition, anything you want to clarify on the subject. That would be great. We can look at it before we close. So we have on the one side the healthy ovary, okay, and then the other side you have a polycystic ovary. So the first thing you'll notice, of course, is how that there are the sort of blue and purple bubbles, if you like, on the side where there's a polycystic ovary, but on the other side. On the other side, you have some more structures. You have some yellow-brown structures as well. In the healthy ovary, what you're seeing is the progression from a very small, immature egg. The development of the egg, basically, is what you're seeing. So you're seeing how the egg starts, how it develops, and how it grows. matures to the point where the egg is ready to be released. That's ovulation. Then if you look towards the bottom, I don't know if you can see my little arrow here, that is ovulation, when the egg is released. And when the egg is released, the little structure that was holding the egg together begins to regress, begins to degenerate, or begins to shrink in size. That's a normal process. That's what happens every month in a woman's cycle. One particular egg begins to develop in the follicle, it grows till it becomes mature. Then ovulation happens, and then the follicle begins to degenerate, and then we go back around the circle, goes around like a cycle every month. That's what happens in a woman who has a healthy ovary. Alternatively, in somebody who has PCOS, it's quite different, because you can see something's not right. This doesn't show it very well, but there's something about the appearance of the ovary. The structure is not very regular, so it's a bit different to the one you have on the other side. And then you don't have the progression from the development of a small egg, its growth, its maturation, to where it's released. So it gets to a point where something goes wrong. The egg doesn't develop properly. It's not even released. And then it just begins to shrink. So nothing is happening. The cycle isn't really happening. It's as if something is blocked somewhere. It's as if the process is stunted somewhere. Whichever it is, whether it's a problem with the egg not being mature enough, or whether it's a problem with the follicle not being able to maintain the egg, or whether it gets to the point of ovulation but it can't happen, whichever it is, the outcome is the same, which is that there's a problem with the way the ovary is functioning. So I wanted to just share this image with you, and I think we can then go on and look at the different issues, the different comments that people might have. And just to remind, for anybody who's just joining, we're looking at 5 things, or more actually, things that you shouldn't say to somebody with PCOS, and why. And I think it's really important, because PCOS actually is a fairly common condition. I know it's not as common as fibroids. Of course, fibroids, you're looking at up to 30% of women globally who might have fibroids, both those who are aware and those who are not aware. But in PCOS, you have within 5 to 10% of women. So it's not as much, but it is a significant chunk of women. So imagine if women with this condition, who have partners, or who have friends, siblings, or parents, bosses, employers, who don't understand how this condition affects them and why it affects them this way, and so they're not given the care that they need. So that's just a reminder of the symptoms that we could get in PCOS. Let's go to the very first comment, that a woman who has PCOS should not be told. Stop saying these things to a woman with PCOS. Number 1, just lose weight and it will go away. So as you can see on the screen, one of the symptoms of PCOS is a woman who is overweight, and there are many reasons why this is present. It has to do with the complex composition, the complex things going on in the body that means that somebody has PCOS. It's a complex hormonal disorder. Even we don't understand everything that's going on that causes PCOS. So it's not just a matter of saying, well, do you know what, just lose weight and it will all settle. Just lose weight and you'll be normal. No, it's not that. Remember that the excess weight is a symptom of the problem. So if you tackle the symptom, you haven't really addressed the problem. And it's not so easy to tackle the symptom and just exercise and get rid of the weight. It's not so easy to do that. And even if you did that, it may not mean that everything else is completely sorted. So it is important, and I want to balance this. It is important that women with PCOS do maintain a healthy weight. I'm going to talk a little bit about that. It's really important, because one of the treatment aims, or one of the treatment measures for PCOS, is losing weight and a healthy lifestyle, healthy diet. It is extremely important. We do agree that if a woman is able to lose weight, that can contribute to managing her fertility issues. But it's not so simple as somebody who doesn't have PCOS, because there's some complicated hormone issues that are going on, contributing to the problem. So yes, we do encourage women with PCOS to have a healthy diet that is low in sugar, so no carbonated drinks and cakes and processed foods and things like that. That is high in anti-inflammatory foods, so fresh vegetables, spinach, things like green tea, olives, turmeric powder that you can include. I'm just giving examples. There are different ones that you can go and have a look at. I think I have a PCOS diet sheet on the website, and if I remember, I'll put a link on the descriptions for that as well, so you can check it out. We also encourage low glycemic foods. So things like oatmeal, legumes, beans, whole grain cereal, low fat yogurt. These are the kind of foods that we encourage women with PCOS to eat. Cut down on lots of dairy products like cheese and full fat milk. Cut down on those because studies suggest that that might contribute towards excess weight. So you're trying to see if you can do things in your lifestyle to help to counter the effects of the hormones. So I totally agree that it is in the woman's best interest with PCOS to maintain a healthy weight. But we need to say to people who are talking to women, and even us healthcare practitioners, I would include us in the boat, because not all of us have a special interest in women's health or are obstetricians and gynecologists, and so may not understand the play of things going on in somebody with PCOS. And so telling, oh, do you know what, just lose weight, that's not the way to respond. It's to understand how it happens and be supportive of such women. So weight loss alone may not be the solution to the tiredness, to the pelvic pain problems, to the irregular period problems, but it is important that we address it in somebody with PCOS and support them on that journey. So that's number one of things that you should not say to women with PCOS or PCOD. Okay, now let's look at number two, and this one says it is all in your head. I think this is really cruel. This is unkind to say to anybody with a medical condition, and we can only excuse people who say that because either they don't realize that this is a medical condition, hence the purpose for this broadcast, but otherwise, if somebody says that they've got PCOS, if you're informed, if it's stated to you that they've got PCOS, it is not in their head. It is an actual medical condition that we can diagnose using blood tests and an ultrasound scan that will tell us that there are abnormal levels of testosterone and estrogen, or that will show us the presence of cysts on the ovaries. It's an actual medical condition. The fact that she's having symptoms that perhaps you cannot explain why she's so tired, or you cannot explain why she's losing hair, the fact that she's got pelvic pain that you cannot feel and you think this person is off work again because of pelvic pain or because she says that they're tired, does not mean that she doesn't have a medical condition that should be taken seriously. So please do not use that term, oh, it's all in your head. It's an actual medical condition. It's not, she's not imagining things. She's not exhausted because she's not up to it or because she hasn't got any willpower. It's important to take her symptoms, her complaints seriously and not dismiss them as being in her head, please. Okay, so that's number two, and let's go to number three. Number three says, let's click on it here. Oh, that's number two. Number three, you'll never be able to have children. Oh gosh, this is even worse in terms of cruelty. Guys, please don't forget to like this stream and share with a friend, because we're talking about PCOS, being a bit of educating on PCOS, yes, but also just trying to create some advocacy and provide some support for women with PCOS and explaining why the symptoms that they have should not be discussed or discarded lightly. They're valid, and we need to respect that, provide support and help them, because that will make them more effective. Absolutely. So the third point, we've done number one, we've done number two, and number three, that people should never say these things to a person with PCOS, that you'll never be able to have children. If you were here at the beginning, or if you go back, or you're watching on the replay, you know that at the beginning I said that PCOS exists on a spectrum. So you have people with mild form of the disease and those with a severe form of the disease, those in between. So there are some women who are able to get pregnant with PCOS without significant challenges, without much problem. That is there. But there are other women who have very great difficulty in falling pregnant. And I did mention that it's a combination of things. It could be because of the weight, it could be of the increased insulin and testosterone that they've got in their system. It could be because, of course, the ovaries aren't working properly. All of those things can combine. All of those things can be present in a woman to different degrees to create the issue with fertility. So it is wrong for us to paint everyone with PCOS with the same brush. It's just not it. It's just one of those conditions that it varies in the way it behaves in people. So each woman is individual. Each woman If she comes with her fertility issues, you need to sit her down, get her symptoms, do the tests, and find out where her ovarian function is, what is her own special need, and deal with it that way. So never ever say to a person, with a woman with PCOS, that you will never be able to have children. This, apart from being unkind, rude, and completely inappropriate, this is the medical reason I've just explained to you, okay? Number 4, please do not say it's just a cosmetic problem. You know why they would say this, or why somebody might think this? Because it has to do with hair loss or hair problems, okay? Excess hair. So some people might have hair loss, okay, thinning hair or losing their hair. Some people have excess hair. It might be excess facial hair, because remember, there's a lot of testosterone. Excess facial hair, a beard or mustache, yes, or chest hair. And unfortunately will be the butt of jokes by people who are just, again, rude and totally inappropriate when you see such things. And I remember knowing a couple of people years back who we as a younger, still young, but as a younger person, I remember seeing women with this appearance, and of course it looked different. But it's not something you go and say to somebody that, oh, do you know what, you just need to treat it, either use tweezers to get rid of the hair or bleach the hair, or all those treatments that people use. It should be investigated. It should be investigated. We know that these are valid symptoms of PCOS. And acne, did I mention acne? It is on the list. It is on this picture. I've kept this picture up so that we can see all the symptoms. Yeah, there you go. There's acne right at the bottom. So let's remember that it is not just a cosmetic problem, not at all. It is, as we've seen, has a variety of symptoms. The fact that a woman is overweight and she's struggling to lose weight, you think she's not doing enough. There's more to it than meets the eye. So it's not just about cosmetics, it's about a complex hormone balance problem. And the answer isn't so simple as, just go and get facial treatments to get rid of the hair, or whatever it is that people might want to suggest. Okay, so that's number 4. We're doing well. Let's go on to number 5. Please don't forget to like this video and let me know if you've got any questions. Thank you so much for watching. If you're here live, I really appreciate your popping in. I know it's a Friday evening where people just want to relax, and I'm not going to keep you for too long, I promise. So the next one is people say there is nothing that you can do about it. Well, do you know what? I think that probably has been inherited from years ago, when we thought that there was nothing we could do about it. So we could forgive people for thinking that way. But here we are to educate them. That's what we're doing, okay? Because yes, there are things that you can do about it. I completely agree that presently medical science does not have a cure for PCOS. I will give you that. But depending on the symptoms that you present with, so we're looking at our symptom. Let's remove this sticker again. So we're looking at the symptoms. There are things that you could potentially do to help manage pelvic pain, irregular periods, for example. So I mean things like painkillers, depending on the nature of the pain. You could help things like acne in terms of treatment. You can help things like weight. You can help to support people in terms of weight loss, in terms of looking at the diet, recommending physical activity or exercise tailored to the individual. There are things that can be done about that. The big one, of course, is fertility. That is the big one that we want to talk about, and that's the big one that is on people's minds when we think of PCOS, because it seems as if it's a what's the word now? It seems as if it's a sentence that, well, she's got PCOS, she can't have children. So that is not true. There is a lot that can be done about it. And that's why I mentioned about individual treatment. So each woman, you sit down, what exactly are her problems? For some women, it's irregular periods. For some women, they've been trying to have a baby and nothing's happening. For some women, it's problems with pelvic pain. For some women, it's a combination. So you need to sit down with each person. When it comes to infertility, there are different things available. Now, we have medication. Medication can be either to help to promote ovulation, if that's the problem. So you have different pills or injections that can be given to women to help to promote or trigger ovulation. There's metformin, for example, is a diabetes treatment. Remember, I've mentioned the hormone insulin that helps to process sugar in our blood, which is abnormally high in PCOS. Metformin is a drug that people with diabetes use because it helps to control their blood sugar levels. And we found that providing women with PCOS with metformin also helps to control their blood sugar, but can also help them to ovulate. So one of the treatments that we give women in order to help ovulate and help towards their fertility journey is metformin. And it's something that there's clear evidence that it makes a difference. So we're now addressing the issue about, oh, there's nothing that you can do about it. That's just not true. Okay, so apart from medication, there might be different other processes. If the medication isn't making any difference, there might be surgery. It's called ovarian drilling, so it might be surgery to support or help to push the ovaries to ovulate. There's IVF if that's not working, if that process or that procedure hasn't worked, there's IVF. So there are different things that can be done, particularly in the quest for fertility for a woman who has PCOS. So it's absolutely not correct to say that, there's nothing you can do about it, okay? Number 6 is, here we go, you should just have a baby. So, I don't know, guys, if you're watching on the replay, let me know in the comment section, or if you're here live, let me know, what have you heard about PCOS? What have you thought? Are there any things that perhaps I'm saying this and you're thinking, oh wow, actually I didn't realize that? Let me know in the comment section. Is there something that you've thought about it and didn't, no, we aren't sure? Let me know. Let's have a little chat about it in the comment section. So you should just have a baby. That's an odd thing to say to somebody who's looking for a child. It's because you think, well, they're not trying hard enough. I don't know, it's just strange. But when I came across this one, I thought people who say that are not thinking too deeply about the feelings or not being too considerate about the person that they're speaking to, because having a baby is a personal decision. It's up to them, really. It's not to do with you. It's primarily their decision. And so it's not something that you force somebody with PCOS. They might be having challenges, or they may not be ready, they may not be at that point. So it's really an inappropriate comment to say to somebody who has PCOS. Okay, so now I know I said 5 things to stop, 5 things not to say to women with PCOS. We're on number 6. I've got a couple more actually, because when I was doing the research, I found some more. And I thought this one was really instructive because it says, oh, it's not that serious. What I want to say to anybody who has that view that, well, actually it is. Any medical condition that prevents a person from living life to the fullest, physically, mentally, emotionally, and so on, is serious. It may not be so serious to you, it's serious to the person. And PCOS can cause a range of different symptoms and potentially other conditions. I've mentioned the possibility of developing diabetes, which is a chronic long-term disease that has serious complications. So this is a serious condition. The fact that it's only women who have it, or the fact that it's about 5 to 10% of women that have it, doesn't mean that we shouldn't consider how important it is in terms of raising awareness about it, both for women and for healthcare workers in terms of diagnosis, but for everyone else around to provide the support that our women need. So it is serious if it's not properly identified and treated, especially when somebody is quite young, that we identify what the problem is, because they could go for years and not know what's happening, not realize why this is happening, and so not get the right treatment. It's important, and it does deserve serious attention. Okay, so the other one I've got here, this one is the one that really upsets me. It says you're just lazy. And this addresses that bit where, right at the bottom here, where I talk about fatigue or tiredness. So again, it's to different levels. And a woman with PCOS is not lazy when she says that she's tired, when she can't do what you expect her to do. And of course, I'm talking about somebody who genuinely has this condition and genuinely has this problem. And I'm asking that there be understanding from those of us who are working with them, or who live with them, or deal with them, that the condition itself, one of its symptoms is tiredness. One of the problems that it causes is tiredness. They're not being lazy. This is not going on because they've just they're just wanting to skive off work, they're not interested in the job, they just don't want to do it or anything like that, no, or they don't want to play, or if it's with a partner, they're tired and they don't want to have sex or something, I don't know, different things that you can imagine. It's a serious condition. One of its symptoms, like I've shown in my graphic that I've just taken off, is exhaustion, it's tiredness. And so if this is going on, it's worthwhile bringing this to the attention of the doctor. Any form of tiredness that is excessive, because tiredness is such a broad symptom, it has so many different possible causes. But identifying that it is PCOS responsible for this, not just gives you the power of knowledge. Okay, so I know what this problem is. How do we solve it? How can we address this? What are responsible? Do I need to pace myself better? Is there a different kind of work style that is more suited to me because of this? Going into all these things so that we find out, rather than just labeling somebody lazy and thinking, oh, they're just not, they're not pulling their weight, or they're just being, they're just not being a team player. So guys, I think we're just at the 30-minute mark, and I'm going to round things up here. Thank you so much for listening, and I hope this has been educational and informative, because that's my goal, to make sure that we're raising awareness of these conditions. Thank you so much for watching. Don't forget to like and subscribe as you leave the show, and don't forget to follow me on social media, Facebook, Instagram and Twitter mostly. I'm there as Askaway, at Askawayhealth. So guys, thank you for watching. Let me know if you've got any comments in the comment section. Don't forget to check out the description. If I don't do it tonight, I will update it maybe in the next 12 to 24 hours, because I've got to get to work later on this morning. Later on tonight / tomorrow morning. But yeah, do have a look. I have other videos on PCOS and endometriosis. I think I did one recently comparing the two, which is quite interesting for those who are sort of, that minded to try and see what's the difference between these conditions. Have a look, please, and let me know what you think. So guys, thank you so much for spending so much time with me this evening, and I hope you guys have a great weekend. And whatever you have planned, whatever you're doing, whether you're having a nice, easy, restful one, or you're really going out into town and doing things, please stay safe. And I will see you again soon. Bye.